new TV5 news segment at 9 a.m. aims to help answer your health questions. And with things potentially changing as far as healthcare goes, we thought this segment was very timely. So today we're talking about the proposed changes in national healthcare. And I'm joined now by Genesee Health Plan CEO Jim Milanowski. Good morning, and thank you so much for being here.
Good morning, Morgan.
Yeah, so this is a heated conversation, I think, in everyone's homes. So with these proposed changes, what will this bring? What can people expect?
Well, first of all, thank you, Morgan. The thing is that this just passed in the House, and so it's now going to the Senate for them to review, probably make some changes. So whatever we talk about in the next few weeks is just what the proposed American Health Care Act that the House just passed. So, but I think what it starts to look for Americans and for the viewers, it starts to have us look at certain trends and issues that are going to be impactful to people. Right. The one thing that's been really controversial is about the pre-existing conditions that people are worried about losing their coverage, and it still guarantees that people would have coverage. It's just that with this new proposed language, it talks about the fact that states could allow insurers to rate people higher because of their pre-existing conditions, and that might make healthcare coverage for them unaffordable then, or really difficult to pay for if that does happen, and that wasn't in place with the current Affordable Care Act.
Okay, and what can people do right now in case these possible changes are made?
Well, I think first of all, we need to get healthier. I think, people are worried about cost. The thing that we can do right now is get healthier so our out-of-pocket healthcare costs are not so great. I think, too, we need to take an inventory of what is our healthcare needs. What do we spend our money on medications and doctor visits, and what kind of care do we need? We're going to need to kind of take a personal inventory of that and know what and be more of a consumer of what do we really need, what does our family need for coverages and care. And then now is the time to really take that step and be an advocate. Let your local Congress and representatives know, and your national leaders, on what's important to you and how you feel about this. Whether you like it, don't like it, now's the time to really vocalize. Once you know what's important to you, express that to people and let people, your representatives, know how you feel about this.
Okay, and most importantly, since it's right here in the area, how can Genesee Health Plan help?
Well, I think being on the show today, and we're going to have this Health Yes segment, is a place that you can come and get updates, and so we're a source of information on these changes. And again, it's going rapidly, and things change all the time, so it'll be a nice central place for that. We still are helping people get coverage, so if you don't have health care coverage, and I mentioned before, we need to get healthier. One of the ways is to have coverage and see a doctor. So we can still help people with that and answer any questions that you might have about health care coverage. And if any changes come down the road, we can help and assist people with that.
All right. Thank you so much, Jim. I feel like that was so much information, but very informative, and people can use that, certainly.
Absolutely.
All right. Well, thank you again for being here. And you can catch Health Yes in the second and fourth Thursday every month right here on WNEM TV5 News at 9. And Jim and I will be doing a Facebook Live talk back later today, shortly, to answer your questions that you have in real time. So be sure to tune in right after the 9 a.m. show on Facebook. So if you're not following WNEM TV5 on Facebook, you do want to do that. You can ask him all the questions you need to know.
And I'll try to have the answers.
You will have the answers. He's very knowledgeable.
Okay.